My topic is simplified treatment of obstructive sleep apnea and utilization of high-resolution pulse oximetry. And I'm Dr. James Metz from the Metz Center in Columbus, Ohio, and I want to thank the AES for allowing me to be here. They're a wonderful group, and I've learned a lot from them over the years. And I really like the title to be an easy way to improve your practice and help people feel better and regain health. Let me hit the high points. David Gozal once said, if sleep were not important, it would be a genetic mistake, and the body doesn't make genetic mistakes. He has been a huge help, and in the regular presentation, I talk a lot about the paper that he was the last author for, and he was my mentor for. But there's 3 rapid insights for the talk. We need patient acceptance of the condition, simplified care, and evaluation of outcome. Now, why is that important? I use Judge Anthony Scalia as the reason. He's a very accomplished man, and he's passed away. So here is Anthony Scalia when Ronald Reagan nominated him to the Supreme Court. And here he is just before he died. How did that man progress from this young, vital man to big and heavy and with a thick neck? I really think we need to talk about that. A normal airway versus an obstructed airway. And he probably had an obstructive airway even when he was young, but it got the best of him. So on the night of the Supreme Court Justice Anthony Scalia died in 2016, his CPAP machine was on the nightstand next to his bed. It wasn't plugged in. Scalia was one of an estimated 25 million Americans with obstructive sleep apnea. Most don't know they have it. It is not that you can die from lack of oxygen on the spot. Restricted breathing pushes the body into fight-flight response, and I'll talk a lot about fight-flight in the complete talk. Part of which diverts oxygen-rich blood to the brain. Blood vessels constrict, and the heart rate increases. With the oxygen supply already reduced, that can damage the circulatory system, especially if it happens night after night. Many years of untreated sleep apnea likely kills many people through cardiovascular events like strokes, heart attacks, and arrhythmias. When the person dies, it is not usually recorded that the sleep disorder had a role in pushing them toward that outcome. Scalia had some of the classic characteristics of obstructive sleep apnea patients. He was an older male, he was using CPAP, he's overweight with a thick neck, and a smoker. And so what I would say about Anthony Scalia, I love Calvin and Hobbes, and this is his famous dead bird comic strip, and as if it's a comic strip. And so, look, a dead bird must have hit the window. Isn't it beautiful? It's so delicate. Sigh, once it's too late, you appreciate what a miracle life is. You realize that nature is ruthless and our existence is very fragile and temporary and precious. But to go on with your daily affairs, you can't really think about that, which is probably why everyone takes the world for granted and why we act so thoughtlessly. It's very confusing. I suppose it will all make sense when we grow up, no doubt. Well, I'm going to try and help you grow up into the area of obstructive sleep apnea and airway problems. So please watch the lecture. Thank you.